going back to the atrial part of things, here, again, we said V1, V2 are our right side of leads, so just real quick from the ventricular standpoint, you see RSR prime, and you see this terminal S wave here. That suggests a right bundle branch block. Talk more about right bundle branch, but that's not why I brought this one up. The reason is because when you first look in EKG, I want you to get a general idea of what's going on, right? Just like when you're looking at a rhythm strip. You see that they're all regular. In this case, they're wide from the right bundle branch, but they're very regular as far as that goes. Then look at the P wave and how the P wave is shaped. And so this is an upright P wave, has a little funny bump in it, but this goes negative and then comes back positive. You might be able to see it better in the screens. And then in lead 3, it's negative. So normal P wave axis, we said, starts from here and goes down that way, right? If lead 2 is down here, and the P wave is going towards lead 2, then the P wave should be positive, right, in lead 2. In this case, it starts negative and then goes positive. So there's something funny about this P wave. Lead 1, it is looking from the left side. If the P wave is coming from the top, from the sinus node towards AV, overall it's going towards the left, so it should also be positive in lead 1. The biggest positive deflection as far as P wave is lead 2. That's why we use lead 2 when we typically assess P wave. We also use V1. The other point is lead 3. Lead 3 is looking from down here, and in this case the P wave is inverted. So that means it's going away from lead 3. And normally it should be going down, but in this case it's coming up and over. And so if the P wave is coming up and over this way, it means it's ectopic. It's coming from a different spot. So this would be an example of an ectopic atrial rhythm. Usually it's going to be bradycardic, right? Because if the sinus node doesn't fire for some reason, if there's sinus node dysfunction or they're on medication or something that keeps the sinus node from firing, the backup to that would be an atrial pacemaker. Sinus node rate's about 600 to 100. A backup atrial pacemaker will probably be around 60, but maybe a little bit less. And then you get to the AV node. And the AV node's typically going to fire in the 40 to 60 range if the sinus doesn't fire. And then back up to that would be a ventricular focus. Ventricular focus would be like 20, 30 beats per minute, right? Maybe if it's a little faster than that. And so that's standard, that's normal. Now, anything could be thrown off by medications or illnesses of various kinds, but that's just the normal thing. So in this case, you're looking at an ectopic atrial rhythm, and you know that because of how the P wave looks. So when you first look at EKG, get the general gestalt, and then look at the P wave, and look for a positive P wave in 1, positive P wave in 2, to know that it's probably coming from the sinus node. Quickly, a caveat about any EKG interpretation, and same thing when you're looking at halters, when you're looking at rhythm strips on the floor, there are exceptions to everything. So you can say that I think this is ectopic atrial, or I think this is sinus if you're looking at a sinus typical with a P wave upright in 1 and 2. And like I said before, first of all, you got to know that the electrical part of the heart, you have to have the mechanical with it. But the other part is a sinus P wave looks like it's coming from the top bottom down. You could have a focus right next to the sinus node that's firing, and it looks just like the sinus. So there are a lot of things that mimic what we would think are normal. But when we read an EKG, we don't write everything out and say, I have a 99.9% chance it's sinus rhythm, and there's a 0.1% chance it's not, right? That would be silly. And so what we do is you're hedging your bets, right? You're looking at what you think, what you've seen before, and saying, based on what I know, this is a right bundle branch block, this is ectopic atrial, but there is that small chance it could be something else. Yes?